Well, good afternoon, everyone, and welcome to our first town hall of winter quarter for our parents and families. It is an absolutely stunning, beautiful 60-degree day in Denver, and we are so excited to have so many students back, whether in person or online. And we thank you, our students, and their parents and families for your support and entrusting your students with us. Now, it's fair to say that many of us were also glad to see 2020 in our rearview mirror, but clearly the events of the past few weeks have shown that these continue to remain very, very troubled times. It's been a very challenging few days for our country as we have experienced both historic civil and political unrest. And yet, it's so great. It's so great to see the excitement of our students as they return to campus. I'm proud of DU and how it is navigating these very challenging times with tenacity, resilience, and character. Now, before I say a few more words about what you can expect in today's town hall meeting, I would like to introduce our panelists. We have a wide range of panelists with different expertise that are going to here to answer your question. And we have panelists that are behind the scene to answer your questions in the Q&A. So I'm Jeremy Haefner. I'm Chancellor here at the University of Denver. Mary Clark is our Provost and Executive Vice Chancellor.
Good afternoon and welcome.
Our Cracker Jack COVID response coordinator is Dr. Sarah Watermura. I'm sorry, Sarah.
No problem. Nice to see everyone.
Jennifer Karras is our Vice Chancellor for Academic Affairs, Vice Provost for Academic Affairs.
Well, I was hoping for that promotion. That was really nice, but I am still really happy to be here and to see all of our students right here on campus now.
Michael Lefar is our Executive Director of the Health and Counseling Center. Michael, where are you?
Good afternoon and welcome.
Todd Adams is our Vice Chancellor for Student Affairs.
Hello, everybody. So glad to be with you.
And finally, Stephanie O'Malley is our Associate Vice Chancellor for Government and Community Relations. Stephanie?
Hi, everyone. Welcome.
And my thanks to all of the people behind the scenes who are helping to answer all of your great questions. I do encourage the audience members to use the Q&A for any kind of questions that you may have, and we will try to get to so many of them in today's hour. We'll spend most of the time answering your questions, as a matter of fact. To start with, though, I would like to just share with you some thoughts about what has happened since our fall quarter. I will start by saying I am so proud of what we have been able to accomplish during the fall quarter and how we mitigated the spread of COVID-19 on our campus. It took many, many people and the hard work that they did from our faculty, staff, and our students was noticeable, palpable, and I am so grateful for it. Our positivity rate throughout the fall quarter remained far below Denver and the state of Colorado. And that's our goal, is to keep that positivity rate low so that we can mitigate the spread of COVID-19. Our researchers found that we outperformed many of our peers, and we celebrate that in terms of our response to the COVID. And while I'll talk a little bit more about increasing our testing efforts, I do want to remind everyone that we gave almost 30,000 tests for COVID-19, thanks to our partnership with National Jewish Health. Over 70% of our community members opted in for our contact tracing app, which is so important to help trace where the pandemic is. And we tested the wastewater regularly, 3 times per week, which gave us a heads up if there were any outbreaks to look for. Did we do everything perfectly? Of course not. But we learned from what we could do better, and we have made changes. And this is just like we ask of our students, I might remind everyone. So what are some of those changes? we spent the better part of December in a heavy review of our data that we collected, in looking at what other universities did, talking to researchers, using our partner, National Jewish Health. And what we concluded was many things. But first and foremost was, not surprising, that frequent testing was the key to success. So for those universities, and there were only a few of them that had better COVID response numbers, they were testing once, maybe twice a week of all of their students. Why is that? Why is that resulting in better management of the spread of COVID? Well, the answer is it enables the university to move faster to identify where those areas of outbreak are and then take appropriate responses. But it also has a behavioral effect. As people know that they're going to be tested, they know that they're going to adjust their behavior as a result of that. So we will be doing more frequent testing, but here's the good news. Our researchers have been working on, for the past several months, a saliva test. And we have found that this has extreme effectiveness in identifying the COVID-19. So we'll be using a saliva test in addition to the nasal PCR tests and the antigen tests that our student athletes use, in order to really get the numbers of testing that we'll need. And the saliva test is much easier, it's less invasive. And so we're encouraged that our students will comply with our increased testing. How will the testing increase? Well, we're going to really target those that are most at risk for spreading the disease. So for example, a staff member who is in an isolated office will not be tested as often as, say, student athletes living in our dormitories. But here's the detailed information about testing frequency. And it's available online, and I'm sure we'll have more conversations about it later today. So undergrads who are in our dormitories or in other congregate housing, such as our fraternities, sororities, will be tested twice a week. Undergraduate students who are not living in the dormitories or are not in congregate housing will be tested once per week. Our graduate students, and today is the first day for our law students to start their classes, will be tested once every other week. Now, that's our testing, and it will be increased, and we are confident that this increased testing will help us manage COVID, especially during the winter months. We know that these are time-tested results that will really improve our ability to navigate COVID-19. Now, what happens, of course, if students become positive? Well, our quarantine and isolation has also made some changes. We are following CDC guidelines now that allow us to reduce or shorten the required quarantine period if certain conditions are met, including receiving a negative COVID test. So this will help, of course, so many things. It'll help us manage those students that need to be quarantined or in isolation, and it will shorten the time of their time in those and get them back working with their fellow students and attending classes in the face-to-face that we intend. Now, behavior is still incredibly important. It's still the key. So students, faculty, and staff still hold the key to our success by following the protocols and being smart to avoid the virus, and how we are asking them to follow the protocols that we have. So what does that mean? It means wearing a mask. It means maintaining physical distancing of 6 feet whenever possible. And of course, using really good hygiene. Now, what about the student experience? What did we learn from the fall quarter? Well, one of the biggest lessons we learned from the fall was how to better engage our students and make this trying experience as easy as possible. Communication is one of those areas, for example. We have made some changes to how we communicate to our students, making it easier for them to really get to the essence of the messages that we need them to read. We're also making it increasing opportunities for safe social enrichment and interaction. You'll hear more about that as we answer some questions in just a few moments. But we do encourage our students to bring forward great ideas. And here's 2 of them that students have brought forward. Our hockey games have started. We're actually playing hockey games in Magnus Arena. There's one on Friday night. But our students have asked, how can they have access to the online viewing? So we've made that possible. We've also had some requests for outdoor heaters and fireplaces so that students can interact with each other outdoors, even in cooler temperatures. You'll learn more about that in just a moment. We're working to ensure that students in isolation and quarantine have access to everything they need to feel supported and, of course, comfortable. And we continue to offer substantial mental health support and resources to our students. But what's the real excitement that's buzzing around on campus about enabling more student experiences to happen, more faculty experiences, more staff experiences? Well, for that, I'm really excited to show you a few images of our 3 brand new buildings. You've probably heard about our Damon Family Residential Village. In fact, some of your students are probably in those residence halls, or students are in them themselves. I want to share some images of our 2 brand new buildings that you may not have seen. I know you haven't seen some of our brand new community commons. So if you'll allow me to share my screen, I'm going to bring up a PowerPoint presentation. So what you're seeing here are some beautiful buildings of our new community commons. It's 136,000 square feet of student union, student-centered space. It's where all of our central dining has occurred. And you can see images of our students already taking full advantage of that. Pizza is a favorite of many of our students. But what makes the Commons so wonderful is the additional study space and meeting space. You'll learn more about this. Our Burwell Center for Career Achievement is another beautiful new building that we've opened up. Again, increasing the amount of rooms for meetings so that students can meet with employers, have sessions and workshops on how to build a good resume and vita, and just have downtime. You'll see some beautiful spaces here and students already taking advantage of the Burwell Center for Career Achievement. So we're super excited about this. I make every effort to go down to the new community commons whenever I go. And I know that our students are taking full advantage of it. I've been able to have some great conversations in the food court area already, and they're loving every minute of it. So we're so excited to open that up. And now I'm gonna open it up for questions that you all have. I'm gonna start with our Cracker Jack COVID response coordinator, Sarah Wadamura, who is gonna elaborate a little bit more on testing. Sarah, couple of the questions that we know are on people's mind is, are students required to do testing? And is our testing capable of identifying this new, more contagious COVID variant that we hear about?
Thank you, Chancellor. Happy to talk about that. So in terms of testing, as the Chancellor described, we did an in-depth study of 98 schools over the break and really identified that frequent required testing makes a big difference in the total number of cases. And so we have implemented mandatory testing. It is mandatory. We have different testing schedules depending on using our own rates of positivity from the fall. We were able to determine subpopulations of our community that had higher positivity rates. And based on that, we made the determination about the testing schedule. So that's where that comes from. In terms of, I know there have been, everybody's trying to get back. We've got, we're approaching about 8,000 people ready to be back here in person, which is really exciting. There's a lot of pressure on the testing pod. They're running 600 tests a day. They're resulting those in about 24 hours right now. So there is a little bit of a scramble, people trying to get their tests in, that kind of thing. That's going to settle down. It's going to be fine. And you also can do saliva testing. If you would like to participate in that, it's optional. And there will be a location at the pod and also at 3 other places on campus, which are separate spaces within residence halls. So they're separate from where the residents are. We can talk about that more in detail, but and that's to provide convenient locations around campus for students that are able to provide those samples. And the saliva samples are returned in about 6 hours. So that gives us also a very fast tool that we can use for testing. With respect to the new variant, what you are looking for in that case is that the spike protein is not detected in the same way that it is when someone is positive for the variant that we have been working with for the past many months. We are in the saliva lab. We are looking for that. The National Jewish is also able to look for the absence of that particular protein or reduced on that particular protein. And just as of this morning, we have talked with CDPHE and they will run samples for us that meet that criteria to see if they are gene sequence them basically to see whether they are the new variant. So we will be able to do that with the saliva-based samples. And the next conversation will be to talk with National Jewish about being able to do that with the nasal swab samples.
Sarah, before you get off, here's a question that just popped in. The kids that have been tested positive, will they be tested again or not?
That's an excellent question. So within 90 days post-infection, you are not supposed to test again. It is not helpful. You generally will still return as positive and it is the same infection that you had originally. So CDC recommendations, the state and city requirements are all consistent, no testing within that 90-day window. We do see some individuals who test positive right away after that 90-day window. So we're working individually with students as they come out of the 90-day window to support their reintegration into our testing program. So as they come out of the 90-day window, they should definitely be in touch with us and we can try to figure out what their next testing date should be so that we can transition them back into the regular testing program, but no testing during the 90-day window.
Terrific. I'm going to turn to Todd Adams to talk a bit more about student engagement, student enrichment, some of the experiences that are planned, and of course, talk a little bit more about isolation and quarantine. So Todd?
Thank you, Chancellor, and good to be with everyone again. You know, we learned an awful lot last fall, and I think Chancellor Haefner mentioned that we did a deep dive at the end of the fall term to just look at what occurred and what we could glean from that. And one of the great things that we learned was that we had over 600 registered events, primarily from student organizations, fraternities, sororities, clubs, but probably 30% of those were hosted by staff or the university or some combination of groups here. And a good number of those were done in person. Probably the healthiest number were done in some form of hybrid where there could be an in-person component and available online. What we know from drilling in is that we had just about 3,500 students that participated in any number of those events, some multiple events throughout the quarter. And that was heartening. And even this morning, as I was getting ready to come on to this call, I noted that we had, I think, 6 new requests for programs or events, including a comedian that will be happening here in the next week or 3. So that has been great. And I think we figured out through the use of Crimson Connect, which you may have heard your students talk about, it's an online platform and also an app that allows students to see what's available, where it's available, and if it requires registration, which it often does for attendance, for students to do that in one fell swoop. So we launched that without necessarily COVID in mind, and yet it has been perfectly timed as it relates to us being able to communicate and to connect students to events and activities and programs, whether they're the ones hosting or they want to attend. Chancellor mentioned the community commons, and it is a phenomenal, I'm in it now, 136,000 square feet interior wise, but we have thousands of square feet just adjacent, and then the greens and the commons, outdoor commons adjacent that allow us to do significant programs. And it has already become a hub of activity, primarily for dining, as has already been mentioned, but we have a plethora of meeting rooms, event spaces. We're hosting and holding classes in the building this quarter and probably will subsequent. And it's provided a spot, whether it is our affinity and cultural groups, our student governance groups, including our graduate and professional students who have long since been kind of dispersed across campus, now have a home. And in order to facilitate health and wellness and safety, we're carding people as they come in for check to make sure they're cleared, but also to create conditions where we can control the numbers of people. We've de-densified through furnishings and other things to make sure that people are staying physically distant, and providing, though, opportunities for students to come in and have places to sit, to study, to gather, again, physically distant, but to gather in ways that we couldn't in the fall. And on a day like today, I can tell you as I look out my window that I can see at least a dozen students sitting distanced. I'm appreciative of that and wearing their face coverings, but really enjoying what this building and all the spaces adjacent have to offer. Chancellor, you asked about isolation and quarantine and how we're supporting students and engaging them while they happen to be there. Chris McCaslin, our interim executive director of housing and residential education, has joined us and is on the panel. And I'm wondering, Chris, if you might speak a little bit to what we're doing and what we've learned from the fall and how that's playing out for us now.
Thank you, Todd. It's a pleasure to be here. We have really deep dived in housing and residential education to really look at the type of programming that we offered our students last quarter, what were popular and successful programs, and what were areas that maybe we needed to improve. And so our RAs they had a week-long training, and they spent a lot of that time working about those programs and those activities. We've really worked hard too with our COVID response team that we have in housing residential education. Our housing protocol coordinator is Rue, and Rue leads a team of 5 field team members and 4 assistant HPC coordinators who are really working to make sure the students who are placed in quarantine and isolation don't feel disconnected, not only from their communities back in their regular housing, but also from each other, and providing opportunities for connection, activities, little games, things like that they can do while they're waiting out their isolation or quarantine period. We're always very open to ideas and suggestions. If there's things that your student has shared that made their experience in quarantine and isolation meaningful, please reach out. We're really excited to learn that so that we can continue to improve this experience for all our students.
Thank you, Todd. Thank you, Chris. Just a follow-up question I think they had is about meals and how they can socially interact. Tell us a little bit about what you're observing inside community commons about spacing and having enough seats for people to enjoy those meals with each other.
It's a terrific question. And one of the expectations that we have on that dining level is an occupancy limit, and that includes the lining up, and we have markings so that students can stay 6 feet apart as they go through. Fortunately, we've got multiple stations, including even a smoothie and salad station on the first floor that allows students to sort of disperse naturally just by the way it's designed. And then we have seating for approximately 50 on that level, again, dispersed and distant. We have some outdoor seating even on that level because we've got some balcony areas. And so students will do that and or go up to the 3rd floor, the 4th floor, back down onto the 1st floor or outside. And what we're learning this week in particular as classes have resumed is many students, as has always been the case, need to grab and go. So, you know, we have compostable material that they can take their food, take it with them on the run, which, as we all know, is one of the significant ways that students do their meals these days. And so we want to support them in all of that. So we're really opening up the entirety of the building. So particularly during peak times, whether that's lunch or dinner, on the weekends, more of that brunch time, making sure even some of the lounge areas in suites or larger conference spaces, again, de-densified furnishings, but allowing students to use those to be able to take meals if they want to stay in the building. Terrific.
Thank you, Todd.
Yeah.
I'm going to turn to Mary Clark and Jennifer Karras, talking a little bit more about the academics. In particular, I think there's some interest in there. What are students really going to experience this winter quarter in terms of the modalities of classes. And here's a specific question that was asked. Can professors distribute lists of names and emails of the students in their classes so that the students can reach out to one another and form study groups and friendships?
Very good. Why don't I start, and then Jennifer, I'll pass it on to you. So our students are learning in 3 modalities this term or this semester, if you're a law student starting tomorrow. The 3 modalities are, of course, face-to-face, and then secondly, hybrid, which includes face-to-face students as well as students who are joining online. And then third would be the exclusively online. Approximately 48 to 50% of our instruction of undergraduate students has a face-to-face component, and slightly lower for our graduate students and professional students as a way to accommodate their balance of work and school. In terms of faculty sharing information on who the students' fellow classmates are, we use a learning management system called Canvas that populates all of that information, student names and email addresses. I'll also be meeting with faculty later this afternoon and can underscore the utility of facilitating those relationships between and among the students in a given class. I'm just going to take the podium, so to speak, for a moment to address one of the Career Center questions I saw. And then Jennifer, I'm going to turn it to you. I saw a parent of an upper class person ask about access to the Career Center. And I wanted to assure you that the Career Center is open for business. One good way to access the Career Center would be to send an email to career@du.edu. But another way is through their open hours. And I just checked their web page, and they do have open hours every afternoon, Monday through Friday. So please encourage your student to pursue those drop-in hours with the Career Center. And then also wanted to share with you the Associate Vice Chancellor for the Career Center is Heidi Perman, P-E-R-M-A-N, and I know that she would welcome inquiries that you might have about the services of the Career Center. So wanted to be sure to address that. And then Jennifer, is there anything you'd supplement there?
I don't know that I could add any more to your excellent answer, Mary, other than to say in the career, when I responded to the career question and I put that link to the Career Center right in there, students can actually log in. There are many ways to participate. So going in, meeting face-to-face is certainly wonderful, but there's another way. There are many other ways for students to do that. Likewise, right before I was just finishing up a financial aid question. And so folks were saying that it's tough to get in with financial aid counselors right now, and do recognize that it's our first week. And for many of us, this has been just a return to campus as well. So we are gearing up. The financial aid office, just like the career office, is open and ready for business. And I'll put that link right in there, and so you all can see in the answers. And that's it.
Thank you, Jennifer.
Thank you, Mary. Thank you, Jennifer. There's some questions on vaccine. And of course, we all know and are anxiously awaiting more information about the distribution of vaccine, particularly for universities and colleges. I'm going to ask both Sarah Watamura and Stephanie O'Malley to join in on answering this question. Stephanie, as our Associate Vice Chancellor for Government and Community Relations, has been deeply engaged in working with the state public health officials, the governor's office, and so forth, which are making broad decisions around the distribution of the vaccine. Sarah, of course, in her role, has established a vaccine working group. And I'm going to let Sarah start off by talking about some of the preparations that we have in mind.
Thank you, Chancellor. So the vaccine landscape is changing extremely quickly. Many of you probably noticed there was a change in the age recommendations just last night. So there are things moving very quickly. It's hard to make plans in those circumstances, but I will tell you what we do know. We have a vaccine working group that is comprised of physicians and health law folks, people from DU who would be charged with logistics on distribution, medical doctors, and also trying to think about, how we think about equity and process. So the working group, following guidance that is being used nationally, is looking specifically at what are the factors that reduce risk of infection and risk of harm, what contributes to equity, and how do we preserve transparency in process. So we are close. We are pulling together a number of recommendations and policies. We will be giving those to the Chancellor and the Provost early next week, and then moving forward with what our plan will be. In terms of where things are in Colorado, the expectation is that the early 1As, the majority of the early 1As will be vaccinated by the end of this week, but that the early 1Bs, so that would be lower risk healthcare workers, as well as individuals who are 70 or older and have medical risk conditions, that process is going to be through the month of February. So what we're talking about realistically, the next round is March, unless there is a big change to vaccine distribution. The university has filed all the requisite paperwork. We have the appropriate -80 freezer capacity, medical record capacity, and staff capacity to be a distribution site for the vaccine. And we have filed the paperwork to indicate that we would like to do that, and we are prepared to do that. We have not yet been designated a distribution site, but we are hopeful that we will be able to be a distribution site when we start talking about these other populations that are more relevant for our situation. With respect to students specifically, right now, students are considered in Colorado part of the general public, unless they meet one of the other criteria. But we are in very active conversations with the state. One of the members of the working group is on the state's advisory panel on vaccine distribution, and we are working hard to talk about how we might move forward with vaccination for students who don't meet the other 1A and 1B criteria. And I'll turn it over to you, Stephanie.
Thanks, Sarah. Just a couple of things. One, I want to mention that, as Sarah talked about, every day there's decisions being made with regards to vaccinations in the state of Colorado and across the nation. And generally, Governor Polis has been very good at distributing information. Right now, there's approximately 70,000 vaccine doses being delivered to Colorado every week. And the distribution of that, as prioritized right now, is again to those in the age population of 70 and over. There was a recommendation by the CDC to drop that number down to 65. And for right now, Governor Polis is not going to subscribe to that, and keeping the vaccine prioritization in that demographic of people who are 70 years of age or older, simply because that's the demographic of where a lot of the positive cases have rested in Colorado. We are in phase 1B of vaccine distribution. As Sarah said, hopefully all of those in that age demographic of 70 or older will be vaccinated by the end of February. And the governor has articulated very clearly that they will be distributing their share of vaccines across different kinds of healthcare providers, again, paying attention to that equity consideration. Right now, hospitals are receiving about 50%. Federally qualified health centers are receiving about 20%. Community partners and local public health agencies, 20%. And retail pharmacies receive 10% of the vaccine supply that's being distributed to Colorado. I want to echo Sarah's comments. We've made overtures to the state to reach out in a partnership to become a distribution site. And we'll keep our contacts alive in that arena, and hopefully they'll come to fruition.
Great. Thank you, Stephanie. Thank you, Sarah. I'm going to give the panelists a little break, and I'm going to try to answer two questions that have popped up. One question is, it refers to the hockey games and how do students watch those games. We will be sending out information that will allow you to understand how they can have access to that. So we'll make sure that that gets accomplished. And then there's another question on commencement. The question is, I'm told that CU Boulder has canceled in-person commencement this spring. What is DU going to do? DU is continuing to plan to have face-to-face commencement activities in June for our undergraduate and graduate populations. They, of course, will be contingent on what the current conditions are in Denver and allow us to have, of course, aggregate congregations of people together. I expect that while we may not have a very large Magnus Arena celebration that we typically enjoy, we will likely have smaller commencement celebrations. We're working on the plans as we speak on that. And commencement is so important in the lives of our students. We're going to be working so hard to make that a reality for all those graduating seniors and graduate students as well. So now a couple of questions. It's really back to the student experience. So I'm going to engage Todd again. Todd, there's a question out there about dining and how dining used to be in the various different halls. Could you help the audience understand why we made the move to the community commons and what we do plan for the dining opportunities in the residence halls as well?
Sure, and really good question. It has been the plan all along to centralize where most meals are taken, and that allowed us to really expand the commons, not only the dining, but the physical presence of the commons to allow for the type and variety that students had long asked for. And so the commons not only provides that space, but we can operate it in terms of hours later and longer, which students wanted as well. So as it stands now, meals are principally taken there, although both Nelson and Halls remain open and available for meal swipe or flex, and there are options there. We are working with our provider, who is Sodexo, our dining contractor, to re-envision and reimagine those spaces. It will probably be this summer when that happens. So right now we're kind of taking use and feedback from students about both Nelson and Halls. And to that end, we're relaunching a dining advisory committee that actually Chris McCaslin will be co-leading and bringing together Sodexo and students and others in our community to think about what our dining is, how it will evolve, and we know that it will. And in particular, those spaces that currently are within our residential halls, how those might look moving forward. So it will iterate, it certainly will evolve, but right now, in order to maximize the opportunities that we have, that the Commons provides, not only space, but in particular, the hours of operation, it gives us some adjacencies to do that in that space. So it has worked well so far. And we also centralize the commons. So when we call it the community commons, it literally situates in the center of campus. So those of you who have been on much larger campuses know what walks can be like to get to and from. It's great that you're not terribly far, no matter what space you're in residentially, to get to the commons. And as Chancellor Haefner has said, the feedback so far has been really good. But we're going to continue to solicit that, and we're going to work over this next quarter or two to really think about how we will look at Halls, Nelson, and other opportunities for dining across campus.
And Todd, there's another question really, again, on experiences, not about dining, but outdoor activities. How can students meet face-to-face in small groups? Are we thinking about experiences in small groups or pods that are common in this kind of environment so that they can participate maybe in sports clubs or
Yeah, we've been working with athletics and recreation to think about the use of some of our outdoor and rec spaces. We did a little bit of that in the fall. I think we will launch more of that throughout not only the winter as weather permits, but certainly into the spring as students have requested that. To that end as well, student engagement, which is an office that really focuses on student activities, leadership development, works with fraternities and sororities, actually work with student leaders to procure a number of large outdoor event type games that students can use and reserve and have access to for free. Some of those we've put up as pop-ups around campus and did that in a variety of ways throughout the fall. And we expect to only grow that yet this winter and spring. So As it relates to intramurals and club sports, those are things we have to work very closely with athletics on and what we can do in this environment. But certainly in smaller pods and thinking about ways to leverage spaces that we have in athletics and on our campus greens, and particularly now adjacent to the commons, I think we'll see a variety of activities kind of pop up on campus and particularly near community commons.
Terrific. Thank you. And of course, the Coors Fitness Center is open for our students. And so they can get a workout in. The swimming pool is open from 12 to 1, for example. And we all encourage our students to be physically active at a time like this. It's a great way to build resiliency and overcome some of the doldrums of the winter and the weather that are out there as well. I'm going to turn to Sarah Watamora again. There's some questions about students living off campus, and how does the university approach supporting students who live off campus but test positive for COVID? Does she need, or he need to isolate in another location? Could you talk a little bit about that question?
Sure. So, so the city requirements with respect to isolation is that you are in your own room with your own bathroom and can have meals delivered in order to isolate. So that's the general requirement. So it depends a little bit on the setup where somebody is living off campus. When somebody becomes positive, we have contact tracers reach out to them, usually within 1 or 2 hours of us learning that they are positive, and those folks are able to talk to them about those requirements and try to troubleshoot around what they should do next. So that's the best way to handle that, is sort of one situation at a time. It depends on the context.
So I like this next question, Sarah. This is also for you. People are already thinking about spring break, so I love their forward thinking here. The question is, with spring break only 1 week, how will students be able to quarantine before returning to campus?
Sure. So yeah, so my understanding of spring break is March 20th to March 30th. So it's 10 days. We have not set all of the protocols for return for spring yet. We are monitoring the conditions closely, and there are a number of questions in the chat. I just wanted to comment on activities and connections. Right now, conditions are looking pretty good. If we return in well and the testing protocols are working well, we will lift some of the restrictions that we have in place. We, in fact, just this week lifted events back up to 25 per person, and we will continue to do that. We want students to be able to engage with each other in person. That's the reason we're here. So I just wanted to let people know I hear that. We are expecting, usually when college campuses return in person, there is a spike of cases as people kind of reintegrate. We're tracking that carefully. So far, it's been very, very low. Our positivity is 1.2%, very, very low, but we will continue to monitor that for about the next 10 days or so. And then if things are looking good here and looking good in Denver, we will definitely evaluate going back to yellow, having more opening, more activities. And I just wanted to make sure that that concern was heard. So I'm sorry, and now I've forgotten track. I lost track of the original question.
You answered it. It was with spring break and the quarantine.
Spring break. So we don't know, quite yet, but we will work that out in terms of the return, trying to reintegrate people. What we did this term is people were able to come back on campus. They just had to wait for their negative test before they could move around. And we have to talk about what the quarantine, what the behavior was like during the time away. So we'll provide more guidance on that hopefully shortly.
Great. Thank you. There's a little bit more confusion. So back to Todd Adams here, a little bit more confusion about meal swipes versus the flex meal plan in the commons versus other dining options. So Todd, could you provide a little bit more clarity on that for our audience members?
Yeah, I'm sorry if I'm getting words confused because those matter. The meal plan, the meal swipe has to be taken at the commons. That's where we've got the 8 to 10 offerings and the later hours. We do have flex or dining dollars that students can use and often have, and those are available to use both at the Commons, but at Nelson and at Halls as well. So again, right now, meals are primarily, and quite frankly, based on the traffic and the numbers we're seeing, mostly happening at Commons. We still have students who potentially on the go will grab something, whether it's a breakfast burrito, whether it's a grab and go item already pre-packaged at Halls and Nelson. And so those are happening in a few more limited hours. And again, we're looking at that with our dining partner and figuring out what we need to do. And as we iterate, it can be in real time. It's likely that we'll look to what we do this summer as a way to kind of continue to expand the dining offering. So right now, meals are being taken at the Commons, and that was done by design intentionally with the opening of the Commons and where it's located. But we also want to make sure that we're providing opportunity for students in a grab and go environment and certainly in a convenient one as well.
Great, thank you, Todd. I'm gonna throw another one at you, and maybe it's one also for Chris. But there's a question about their student that is living in the residence halls, in particular the Damon family residence halls, and wondering about what's the expectation for our residence assistants, our RAs, and their engagement in helping students connect to each other on the same floor. So could you talk about that a little bit and help the audience know what our expectations are and how we can make sure that there are the appropriate connections being made for our students?
Thank you, Chancellor. Our RAs have expectations for programming in the residence halls, and we have set up ways that we can make sure that they're meeting those expectations. I think for our RAs, some of them really wanted to focus on individual relationships this first quarter. Some of them focused on relationships within their suites or roommate pairings. And so we really allowed for some flexibility that first quarter because we didn't know what COVID meant, and we wanted to take it on an individualized approach for each community. And so we've learned a lot from that, what was successful, what was not successful. And so our RAs do have programming expectations that will engage not only on the individual level, but that will also engage on the community level within their floor. And we will be having the RAs submit that information to us so that we can ensure that that is happening in a consistent manner across the campus. And again, as restrictions lift, as things improve and conditions improve on campus, we will then expand it to programming across campus. We're also really excited that we have reached out to a lot of our campus partners. Dr. Adams had shared about the over 600 programs that we had here on campus, and we have reached out to those partners, and we're going to actually be working with them to have our RAs bring our students, whether it's bring them through the Zoom meeting or bring them in person to those activities so that they can meet people outside of their hall as well. So we really learned a lot from first quarter and have appreciated our residents' feedback, and we'll now have a consistent approach to that.
Terrific. Thank you, Chris. I'm going to turn to Michael Lefar, our Executive Director of the Health and Counseling Center. What we offer in counseling, I think, is one of the best in class across the country here. Michael, would you just describe a little bit about the services that your center offers and the importance of making sure that students know about those services as well?
Absolutely. Thank you, Chancellor. Yeah, we're very proud to offer, unlike most counseling centers which have session limits, we do not have session limits here. We really see we have a robust team of lots of various trainings and backgrounds available to our students. And we think that we see sort of mental well-being as a part of overall health. And our wait times are generally less, right at this time of the year, less than 10 days, which I think is really robust. And we always, in addition to that, I would say that students who have acute needs, 24 hours a day, 7 days a week, we have licensed mental health professionals here for students. So if there's an acute need, students can get in the moment support from a licensed mental health professional, but those folks looking for ongoing support, we really work to get students in very quickly and see that as a part of overall health and well-being.
Thank you, Michael. Some more questions here for us to answer from the audience here. Let's see, let's turn to Mary Clark and Jennifer again. Talk to us a little bit about how we're supporting our faculty, our professors, as they, of course, engage with this complicated technology, whether it's Zoom or other platforms that we have. How are we helping them overcome some of the challenges that are inherent in some of that teaching online?
Great. Why don't I start again and then turn to Jennifer? We have invested significant time and resources in preparing our faculty to teach effectively in both the hybrid modality as well as the online modality. So every classroom has been outfitted with state-of-the-art AV equipment, which was then validated over this last break to make sure that everything is in good working condition or upgraded, as the case may be over the winter break. We've had any number of pedagogy sessions with our faculty so that they are able to be most effective in the online space and the hybrid space with your students. We are supporting our faculty on a weekly basis with any number of programs that pinpoint particular concerns that faculty have in the Zoom or other online space. And we've assisted our faculty with the provision of classroom assistants, students who help integrate both the face-to-face learning and the online learning so that faculty can be addressing both of those bodies of students simultaneously. Jennifer, it'd be terrific if you could supplement.
Sure. I think just to say that the investments also have come in the shape of having instructional designers. And so as faculty have revisited their courses and really thought about what's the best way to get the content across to our students in any modality, but specifically in those that are in hybrid and remote modality, instructional designers have been able to go in and help them think about their class assignments, think about the way that the courses are experienced by students. So from that course design through to the delivery, as Provost Clark had talked about, the technology piece that's there, and then the ongoing support. We have that particular office that supports our faculty, the Office of Teaching and Learning, whether those are workshops, whether those are course redesign institutes, or whether it's one-on-one kind of instructional support. So we are really trying to meet our faculty, they are just like our students, really come equipped with, they arrive with in many different places, and we just want to meet them where they are and take them to where they need to be. So thanks for asking.
Thank you both.
Thank you.
All right, well, we're getting close to the end of our hour, and I would like to show the video, but before we get to that, I'm going to try to hit some miscellaneous questions here. There's a question here of how we ended up in the fall quarter in terms of the number of COVID cases. The question really says your dashboard indicated close to 1,000 that were infected on that. I'm pretty sure that that's not the accurate number. I'm going to ask for Sarah to talk a little bit about how we ended up in the fall quarter there. And of course, the question that many people have is, what are some of the conditions, or how are we thinking of if we have to make some pivots along the line? I'll simply say that we meet on a daily basis to review a variety of metrics that help keep us informed about the condition of the virus, both on campus, in the city of Denver, and in the state of Colorado, as well as the nation. We take into account where the public health orders are, our relationships and the conversations that we have with city officials regarding that, our capacity to isolate and quarantine individuals, our capacity to test, and of course, areas of outbreak that may occur. So there's a wide variety of different variables that we take into consideration. And no one single variable is our singular focus. We do spend a lot of time looking at positivity rates, of course, but there's so many others that we take into consideration. Sarah, do you want to just close and with that last question, and then I'll close back with the video that we want to show everyone.
Sure. We did have more cases than we would like to have. So I want to acknowledge that any cases is something that, of course, we would want to avoid. We also monitored very carefully for any serious illness, any hospitalization, that kind of thing. And we had very mild to moderate cases among our student population. Our positivity never went above 6% on campus, even when Denver reached nearly 15% positivity. And as soon as the conditions in Denver began to be clearly escalating and concerning, we put into place our 2-week pause and transition remote plan, which we had articulated in the summer. And that is why we were remote in week 10, at the end of week 9. We have the case number that you're referring to, that 900, and I'm not sure the exact number off the top of my head, but that is cases ever. So that's not just for fall quarter. But the reason we're implementing the much more aggressive testing regimen is because we would like to bring that number down for winter quarter, regardless of what happens in the conditions in Denver. So that's the reason that we're making that change, is that we agree with that. So we didn't exceed our capacity. We were able to keep people, as I mentioned, most illnesses were quite mild. So I want to, I don't know how long the video is, but I'll stop there.
Thank you, Sarah. The video is very short, but I want to thank, of course, our panelists for their time today and answering the questions. I want to thank the people who were in the background answering so many of those questions. I especially want to thank, however, the audience members, the students and the parents for showing up. This will not be our last town hall meeting. We will be offering more of these along the way to help answer your questions. Please feel free to reach out to us so that we get your questions and answered in a timely manner. And we look forward to hearing from you, and of course, look forward to engaging your student in an exceptional educational experience here at the University of Denver. And with that, I'm going to ask Weston to turn over to the video, and we will sign off. My favorite saying right now is stay positive, test negative, everyone. Thank you so much for joining us. And Weston, would you play the video? Thanks, everyone. Enjoy the day.